Thank you for joining the AssistRx Patient Assistance Program Blueprint, Finding the Right Balance of Tech and Talent to Optimize Free Drug Programs webisode series. My name is Kathleen Chacon, and I am an AssistRx Patient Solutions Site Director.
And I'm Brock Vandersteen, Vice President of Business Development at AssistRx. In this three-part webisode series, we'll be talking about the current state of patient assistance programs, or PAPs, in the US, how to tailor your PAP to meet your stakeholders' needs, and how to build and maintain brand loyalty. In today's webisode, part one of the series, we'll talk about the current state of PAPs in the US and what it means for your program design. Specifically, we're going to dive into the growing importance of PAPs, evolving needs and preferences of providers and patients, and how the perfect balance of tech and talent can serve these populations. Kathleen, can you kick us off with an overview of the current state of PAPs in the US?
PAPs have been around for years. Some are manufacturer-sponsored, and some are nonprofit or third-party charitable foundation-sponsored. Some are a combo of two. Copay assistance programs cover all or part of insured eligible patients out of pocket for brand name drug. These are typically manufacturer-sponsored and funded. PAPs also support uninsured and functionally uninsured eligible patients with free drug. This can be manufacturer-sponsored, or they can be sponsored by nonprofit, third-party charitable foundations that receive funding from manufacturers and other entities. Alternate funding programs support eligible patients with affording their medications, as well as financial assistance for transportation, housing, childcare, and more. These can be sponsored by nonprofit, third-party charitable foundations and funded by manufacturers. Today, we'll go ahead and focus on manufacturer-sponsored PAPs. There are currently approximately 375 manufacturer-sponsored PAPs, providing $13 billion in no-cost medications for those in need. That's huge. Over the last decade, these programs helped more than 36 million uninsured or underinsured patients gain access to therapy. While eligibility requirements vary, manufacturer-sponsored PAPs require at least U.S. citizenship or residency, an applicable diagnosis and valid prescription with physician signature, an application, uninsured or underinsured status, federal poverty level, and that's FPL, determination, and even prior authorization. This is a lot of information to obtain upfront and track ongoing. Patients can be qualified and enrolled in manufacturer PAPs at any point in the year, but may need to re-enroll or go through re-verification at a predetermined interval. Brock, why don't you expand on the growing importance of manufacturer PAPs?
Absolutely. So we all know the US population is growing. Americans are living and thriving into their 90s, and those with complex conditions that used to be death sentences are actually now thankfully very manageable due to modern medicine. As such, US prescription drug use is growing rapidly. Nearly half of Americans have used a prescription drug in the last 30 days. About a quarter have actually used 3 or more prescriptions in the last 30 days, and about 13% have used 5 or more prescription drugs in the last 30 days. Next, let's look at drug prices, which are obviously a hot topic these days. With rising drug costs and consumer cost sharing for medical care, more and more patients are in need of financial support programs. The average annual cost of one specialty drug was almost $79,000 annually in 2017, and specialty drug costs have been increasing steadily in price by an average of roughly 226% over the last 12 years. In contrast, inflation has also risen by 25% during the same 12-year period, impacting the financial burdens on patients. Premiums and deductibles are also on the rise. For example, in 2019, the average annual employer-sponsored health insurance premium increased by 4% year over year to just over $7,000 for single coverage, and by 5% year over year to just over $20,000 for family coverage. In contrast, workers' wages increased by only about 3%, and inflation by 2% in that same time frame. So there's a bit of a delta. As we all know, the first half of 2020 has been challenging due to COVID-19, leading to business closures, layoffs, and rising unemployment. In mid-May 2020, the Kaiser Family Foundation estimated that 27 million Americans may lose employment-based health insurance due to the pandemic. But even before COVID hit, nearly 28 million Americans were already without health insurance, and millions more had limited coverage to begin with. The sum of these factors is that ultimately financial burden is a leading factor for non-adherence. Patients with greater cost sharing tend to reduce the use of prescription therapies, And in fact, many studies indicate that patients reduce the use of high cost and low cost care in similar proportions, but cost-related non-adherence disproportionately impacts patients with chronic conditions. Even before COVID-19 hit, 1 in 4 Americans reported they couldn't afford their medications, and nearly 30% reported not taking their medications as prescribed due to cost. So it's a simple equation. A rise in drug prices, cost sharing, and unemployment equals reduced both primary and secondary adherence. Further, just asking, your market adherence teams, I'm sure you'll hear, they may not be seeing a plummet in commercial scripts yet, but I'm sure they're not seeing a spike either. Why is that? Because your patients are either qualifying for PAP, switching to a therapy with lower out-of-pocket costs, or skipping their medications altogether. So now is the time when you can capture and retain patient loyalty through a patient assistance program. And designing a PAP that serves the unique needs of patients and providers while also facilitating timely access is critical. So let's jump ahead. Kathleen is now going to talk about the rapidly evolving needs and preferences among patients and provider populations.
Thank you, Brock. Today's customers expect immediate access to information at their convenience, whether it be for online shopping, mobile banking, virtual mental health counseling, or just a few examples of the tailored real-time experiences American consumers have come to expect. And guess what? Providers and patients are consumers too. However, be mindful that some providers and patients lack the capability and/or preference for digital methods. When designing your PAP, you need to take into account your entire provider and patient population and meet them where they are in their workflow and in their life flow. Consider your product, patient, provider, and payer profiles when determining whether you can implement a fully electronic PAP or need a talent-enabled PAP. More manual support is needed when you have a complex therapy journey, high risk, and limited tech use patient populations. Less tech-savvy provider offices unfamiliar with specialty drug processes, and payers with minimal electronic capabilities. Automation can be put in place when you have mature products with less complex therapies, low adherence risk, and highly motivated patient populations. Tech-savvy provider offices familiar with specialty drug processes, and payer with electronic capabilities.
So with everything that Kathleen just covered, is a fully electronic patient assistance program possible? Absolutely. All the way from initiation to re-verification, depending on payer capabilities, of course. And due to our evolving more virtual environment, you may want to closely examine this option. Providers are working to limit on-site interactions to follow social distancing measures. This means less and less patients come into the office and minimal access for your field teams. And as such, it is becoming critical to offer patients a one-stop shop virtual access point to complete e-consent, enroll into patient support programs, access on-demand disease and therapy-specific information, and a whole lot more. Gone are the days when field teams can drop off marketing collateral, how-to guides, and other materials. If you haven't already, now is the time to think about how to offer these things virtually. It's also important to know now more than ever to make the process as simple as possible for providers as well. They may not have at their disposal that cheat sheet, sticky note next to their phone with all their patient support program phone numbers, or that binder with all their portal logins. And just like your patients, your provider environment has been disrupted, and they really just need that one-stop shop virtual access point.
So we've talked about the growing importance of PAPs and the evolving needs of patients and providers in today's environment. We've also learned that you can optimize your PAP to meet the needs of these consumers through automation and electronic processes. We've learned that there may be scenarios in which technology does not make sense for some stakeholders, and that's okay. We'll address this in our next webisode, part 2 of the series, about how to tailor your PAP to best serve your various patient and provider populations. Until then, visit our website at assistrx.com to learn more about the intelligent way to initiate and advance specialty therapies.